Speaker Fabian Núñez, surrounded by Assembly Democrats, the governor, and dozens of health care reform advocates from California, celebrated the historic vote to approve the Health Care Reform and Cost Control Act by the State Assembly.
This is truly an historic day for California. 70% of the uninsured are now going to have health insurance. We're going to contain the cost of the premiums that have been increasing at 2.5 times the rate of inflation for people who do have health insurance. Ultimately, the cost of health care will go down, the quality of health care delivery will improve, and California will be better for it.
The clerk will open the roll. All members vote who desire to vote.
The Democratic bill, AB 1X1, is an achievable way to cover nearly 4 million uninsured Californians, including all the uninsured children in the state. AB 1X1, which is co-authored by Senate President Pro Tem Don Parada, now heads to the California Senate.
Well, we're very close to being done. We're not done yet, but we're one step away from closure on this. Today was the most difficult day because we had to get the vote out of the California State Assembly. We did that. Now it's up to getting it done in the Senate. But getting an agreement with the governor was the most difficult thing. Once we got past that, the rest of the hurdles are going to be easier.
Go ahead, open up. Let me take a look.
The health care reform plan is self-funded and based on the principle of shared responsibility. The financing aspect of the reforms, which includes an increase in the cigarette tax as well as hospital and employer fees, would be presented to the voters as an initiative on the November 2008 ballot.
We're going to call on the voters to join us in this discussion about improving California's broken health care system, and I'm very excited about the future here.
The financing of the Health Care Reform and Cost Control Act will not have a negative impact on the state general fund budget. In fact, it would bring additional funding from the federal government into the state coffers. This report was produced by the Speaker's Office of Member Services.